Hello, I'm Dr. Evdokia Chasioti. I'm the specialist periodontist here at Smile Cliniq. With 14 years of experience in the field of periodontology, I'm here to address some common questions and concerns regarding gum recession and the pinhole gum rejuvenation technique. As a little bit of a background for myself, I graduated dentistry at the Aristotle University of Thessaloniki in Greece, and thereafter I continued with my specialty in the States at Rutgers University in New Jersey in the field of periodontology. The first specialist in London and the UK that I brought the pinhole gum rejuvenation technique. Periodontal disease is a major cause of gum recession. Patients start to lose bone under the gums as a result of periodontal disease. Therefore, the gums start to pull away from the teeth surfaces. Another major risk factor for the progression of gum recession is traumatic or abrasive brushing. Commonly, patients are brushing hard or using the wrong toothbrush or using the wrong brushing technique. Therefore, it's really important that we attend regular hygiene visits, review with our dentists and hygienists. Another reason we get gum recession, recent or ongoing orthodontic treatment. Piercings or tongue piercings can result in severe gum recession. And lastly, parafunctional habits such as nail biting or pens biting or any other mechanical or chemical trauma will result in gum recession. Patients I see are suffering from periodontal disease or periodontitis, which is inflammation of the gum. I treat patients that they present with gum recession, which means that their gums have pulled away from the tooth surfaces, the teeth now are looking longer. This results into functional and aesthetic complications. There is two major complications related with gum recession. The patients present complaining about their teeth looking longer, their gums pulled away from the teeth surfaces, the roots of the teeth are exposed. As a result, black triangles start to appear between the teeth. Therefore, the patients present with sensitivity on hot or cold drinks, even sensitivity when we breathe the air that we breathe. The patients would complain about sharp pain when they try to eat or drink something that is colder or hotter than a lukewarm temperature. Become very self-conscious because the food is getting trapped between the teeth. Therefore, that affects the everyday activity because they would need to repeatedly remove the food between the teeth, resulting in them being self-conscious whether that's done effectively or not, and whether they can present their smile or even speak comfortably with other people, and that results into them covering their mouth with their hands or even avoiding human contact as a result of this condition with the gum recession. Speech can be affected because when we speak and there are black triangles present between our teeth, the air that we breathe is going to go through our teeth, and that will result into lisping. Consequently, we understand that this can affect professions such as acting or singing or any profession related with articulating speech perfectly. The pinhole gum rejuvenation is a minimally invasive technique for treating gum recession. Unlike traditional gum grafting techniques, it eliminates the need of harvesting the graft from the roof of the patient's mouth. We don't use invasive instruments such as scalpels. We don't need to stitch the gums because the gums are repositioned in the line that they're supposed to be. It increases the patient comfort, the healing is faster, and increases the patient mobility. The procedure will probably take an hour or 2 hours, depending on the extent and the severity of the recessions. We're able to treat the full mouth in one appointment. Even all the teeth of the mouth are affected, and we can complete this in one session for the full upper and lower jaw. And the procedure will last probably 2.5 to 3 hours maximum. With regards to healing from a traditional gum graft, the area that is mostly painful for the patient is the wound on the roof of the mouth. It's usually presented as pain that is similar to a bad pizza burn or a bad coffee burn on the roof of the mouth, which will take about 4 to 5 days to subside. When we compare this technique to the pinhole gum rejuvenation, the pinhole gum rejuvenation eliminates the need for that secondary wound on the roof of the mouth, and therefore the healing is faster, the recovery is less painful overall. There are some cases where traditional gum grafting would be the only option for the patient. Those would be cases where the patients have now so advanced gum recession that they've completely lost their strong attached gum. Gum graft from the roof of the mouth is the only option that we have that can actually recreate gum from not having gum at all. When we compare this technique to the pinhole gum rejuvenation technique, we have to have some existing gum present in order to be able to reposition and rebuild the gum line to where it was before.